Hey everybody, I'm back Thursday and we are talking about medical malpractice or trial by media. So we had a great conversation on Tuesday, I guess it was last Thursday. It seems like the same week somehow. Hey Carrie, we had a great conversation last week on Thursday about whether or not branding is the practice of medicine. Hey Jean. And this week, or this conversation, we were going to talk about whether or not it makes a difference if a doctor does it or if it's a layperson. Hey, June. Hey, guys. Nice to see your faces. Sorry, I'm a little late. I was on with a client who just signed up for my course. So I was just getting her all taken care of. So thank you guys for being patient and coming to say hi. So I really enjoyed our conversation last week. I thought it was really great. We really, were able to cover a lot of ground about branding and kind of go through everybody's different thoughts and concerns from both sides as to whether or not branding would be the practice of medicine. Did you guys enjoy that? Was it helpful? It's helpful to me. I hope it was helpful to you as we kind of learn how to think about these things in different ways. So now I wanted to do a similar process today about if a doctor does it, if that makes it any different. So again, I think having these conversations is helpful, I think, in so many different ways. And hopefully I'm hoping that this is also nourishing for you guys to be able to try to think from different perspectives about all of this stuff and figure out this crazy world. But let's jump in. So what do you guys think? So last week we went through the medical legal definition of the practice of medicine. We went through the machine that was used and whether it was a medical piece of equipment, and if having it be a medical piece of equipment made it a medical procedure, or if a layperson can use that. We went through the patient-physician relationships. We went through anesthesia. We went through, all a whole bunch of different things. So if you guys missed that conversation, it was awesome, and it's recorded and it's on my page. So you can certainly go there and catch up on that last conversation. But that being said, and having kind of gone through, I think, at least for me, definitely towards the end of the conversation, I think most of us had thought that branding is just not the practice of medicine. With everything we discussed, with all of the different aspects that we had discussed, it was, I think, pretty clear that branding wasn't the practice of medicine. Now, the outstanding question that we're left with is, does that change somehow if a doctor does it versus a tattoo artist or a layperson? Jean says, I think these days it all depends on however social media reacts. Yeah, social media seems to be a lot of these days. Seems to be a lot. I have to make sure I'm not reading it wrong, but I think there's a typo. Social media seems to be a lot of these days, which is ridiculous. Yeah, social media does seem to be influencing a lot of legal decisions, which is very unfortunate because ideally we have medicine and science and we have legal objective process so that opinions, prejudices, emotions don't become involved in deciding somebody's fate or liberty, deciding somebody's health or survivability. There's very, very clear reasons why science, objective, evidence-based medicine, and objective legal process are upheld. So I agree with you, Jean. It was meant to say that social media seems to be the law these days. That makes a lot more sense. Thank you for clarifying. Yes, I would. Unfortunately, I agree. And even if legal process is upheld, sometimes people are just crucified in social media or in the media, and their reputation is destroyed and they're canceled, and there's a tremendous amount of impact to that as well. So, well, it is a very intimate little setting today. We've got a small little group. Maybe it's because I didn't send out my little message earlier today. I got to be better with that. So anyway, let's make good use of the time here. What do you guys think? So after last week's conversation, like I said, it kind of seemed branding wasn't the practice of medicine. Does it make a difference if the person doing the process, helping with the process, is a physician, or if they were a tattoo artist or a fraternity brother or your best friends down the street? You two decided you wanted to get a brand. Does it make it the practice of medicine if a doctor is doing it? What do you guys think? I can wait. Conversations, I can't just have these conversations with myself. Somebody's got to talk to me. It depends on if the doctor advertises that they also do that. Interesting. Okay. So if in my medical practice, or if in a doctor's medical practice, part of their medical practice is, I don't know, cosmetic branding. I don't know if there, I don't think there's such a thing that exists, but actually, I know there's nothing that exists that way, because we know there are no medical teachings or courses or anything on branding. But if a doctor were to, they certainly can do piercing, they certainly can do tattooing, but branding has never been taught in any, and even surgical things like that. Hey Kelly, what's going on? But okay, if a doctor were to offer, for some reason, branding or aesthetic scarring or something like that, then potentially there's some sort of patient-physician relationship that was agreed upon. They advertise, in my practice, I'm doing this, I'm a doctor. If you want to get your brand done by a doctor instead of a tattoo artist, you're welcome to come to my office and I will take care of that for such and such fee, whatever. There's no insurance codes for branding because it's not a medical process as far as I know. So they wouldn't necessarily be covered under insurance or anything like that, but certainly they could have a cash exchange. So what do you guys think? If a doctor were to advertise that way and there was more of a patient-physician relationship, would that make the branding a medical procedure? I don't think my statement means necessarily that it becomes a medical practice if a doctor does it. Yeah, it's hard to say, right? Like, if it's not a medical practice, because I don't think you can get a referral for it. I left, but it's the truth. So then it begs the question, like, is it a medical procedure if you can get a referral for it? Hey Matt, what's going on? We are in the middle of talking about if it makes a difference if you're a physician. Oh, I laughed, but it's the truth. Jean, these typos. We're in the middle of discussing if it makes a difference if you're a doctor who does the branding versus a tattoo artist, a body modification artist, a fraternity brother. Does it make it, last week we talked about, is branding medical practice? So if branding's not medical practice, which I think we came to last time, if it's not medical practice, does it become medical practice if a doctor does it? And Jean had brought up the point of, well, if a doctor advertises it, then potentially it's medical practice. I do think it could be closer to that. There's some sort of patient-physician relationship that would be established there. There's an exchange of fees. There's an agreement, which to me, that borders a little bit more on medical practice, or at least something that doctor is doing within their practice. So the board, or the medical board, I think may have more jurisdiction if a doctor were doing it as part of their medical practice, if they were advertising it as their practice. I do think that the board may have more jurisdiction over that, and they may consider that medical practice, because now you are taking that patient on as a patient, and you're responsible to uphold medical standards if that's the case. So I think that's a good point, and I think that that may be the case. Certainly in my case, there was no patient-physician relationship. Certainly I was not advertising. There was no, there was no exchange of monies. There was no insurance claims, and there certainly was no agreement, patient-physician agreement in any way. It wasn't in a medical office. It wasn't medically advertised. None of those things were true. Hey guys, I'm so sorry. I think Stars PMD, you may have told me your name in the past and I forgot. Lucky Vixter, I could guess that your name might be Vicky, but I'm not sure. So just drop me your name, guys, so I can properly address you in the conversation. That'd be awesome. So, and if you're just joining, we talked last time about whether or not branding is the practice of medicine. We pretty much came to the conclusion that it wasn't, but if it's done by a doctor, thank you, Jeff. Oh no, there was another, it wasn't the same person. There was another Jeff, but I'm going to get them all. So Jeff, perfect. Thank you. If it's done by a doctor, does that mean it's then the medical practice? So what do you guys think? Jean has certainly been keeping the conversation alive here. I appreciate it. If a doctor does the brand, does it make branding medical practice? So last time we gave the medical legal definition. Vicky, perfect. Okay, great. Last time we gave the medical legal definition. It was very clear that this was, a brand does not diagnose. In the branding process, there was nothing that was diagnosed, treated, operated on, or prescribed for. So that's the first part of the definition. And there was no injury, deformity, pain, or illness that was treated by any of those things. So it seems pretty clear that branding wasn't the practice of medicine. But now, again, if a doctor does it, does that make it different? So Jean adds, I don't think it's medical practice anywhere. You don't need a license for it. You just have to be good at it, and the customer is going to have to make the right choice if they happen to want a brand. Yeah. I tend to agree with you. It's not treating, diagnosing, prescribing, or operating for any type of illness, deformity, pain, or of anything like that. So nothing's being healed. So I tend to think it's not medical practice. I do agree that if a doctor were advertising it and they took somebody on as a patient and they were doing it in that regard, that I think, so the reason I say that, and let me give you a little bit of an analogy, guys. Hey, Rhoda. If I were to, this is going to be a crude analogy, and I blame my attorney because he's given me this example. He has been doing medical representation for, I think, 40 years in this field. Hey, Jeff, how's it going? And he's had doctors where in their medical practice, and it was in their medical practice because it was in their medical office on their medical table. Let's say a doctor decided that he was doing a medical exam and this woman seemed to be coming on to him, and he decided he was going to have sex with her on the table in his medical office. I don't think sex is a medical procedure, as far as I know. It's not treating, healing, diagnosing, prescribing for any type of dysfunction in any way. I could be wrong, but I have never used sex as a medical procedure. However, he's doing that within his medical practice. So even though intercourse or sex is not a medical procedure or process, he is now doing that within his medical practice, and that would be for sure considered medical malpractice. Jeff says, people do this without any medical background. I don't feel this should be considered medical. I agree with you. If you missed the last conversation, Jeff, I think you would totally enjoy it. The last one we just basically discussed is branding the practice of medicine, period. Hey, Ori, what's going on? And we went through everything, the medical, the piece of equipment that was used, the definition, if there's insurance codes, all sorts of different things. And today's question is really, we get that, but doctors are doctors. They're held to a higher standard. They went to school, they took an oath. If a doctor is in a tattoo parlor or is, with their friends, if a doctor decides to do a brand, is that now considered a medical procedure because it's done by a doctor? Does that make it medical practice? So yeah, what else? What are your thoughts? Jean has been dishing them out, but tell me, if you weren't a doctor, this would not be happening. That is for damn sure. But I think because is this another typo, Jean? We're gonna have to have an intervention. I'm voice texting and it's being screwed up. I'm sorry. It's okay. It's very entertaining, actually. If you weren't a doctor, this would not be happening. I think it's because all cats are a doctor. This is being made a big deal. Yes, because I'm a doctor, it's being made a big deal. But I do think it's difficult for people to make the distinctions. They think because I think the old school way, and one of the doctors that was on the hearing committee that was deciding my fate, the fate of my medical license anyway, was very old school. He was in his 70s. He was a plastic surgeon, super old school. And, very much back then, you weren't a human that decided to study medicine and become a doctor. It's like you were a doctor. Like, you were a doctor. Everything about you was a doctor. You weren't a doctor, or you weren't a person who has a personal life and a family and many different careers maybe, or maybe an entrepreneur plus a doctor plus you were seen as a doctor, and like everything you did was then being judged as if it were through a medical lens. And I think that was very difficult for him to separate. I think because of that old school thinking, it was very difficult to make the distinction of, well, I'm a human, and in certain environments, I act as a doctor. In certain environments, I act as an aerobics instructor. In certain environments, I act as a personal trainer. In certain environments, I act as a teacher. In certain environments, I act as an entrepreneur or a mother or a wife I'm not a mother or a wife, but you get my point. There are different roles that we play. And if we can't make those distinctions, it's very difficult to evaluate properly if it's the practice of medicine. So as an example, when I teach aerobics, it's very interesting. One of the analogies that we used, was, let's say I'm teaching a spin class, which I've done hundreds of times. So I have a class of 30 people in front of me. There's 30 spin bikes, right? And everybody comes into the class, they file into the class, they get on their bikes, they set them up. There's a specific way to set them up. They've got their heart rate monitors in front of them. They're ready to go. And let's just say, because I'm a doctor and I'm teaching an aerobics class, does that mean that I have to do a physical exam on every person that walks in the door? I mean, that would take the entire class. There would be no class. Do I have to, is that something I need to do? I mean, what if somebody drops dead in my class? What if they have a heart attack and I didn't do a physical exam? Should I lose my medical license for that? Should I be treated as a doctor teaching an aerobics class? In my opinion, and I'd love to hear what you guys think, no. Because it's not appropriate for that environment. If I were to do a physical exam on everybody that walked in that room, we would never have a class. We just wouldn't. The process of having a gym membership or having a membership to take an aerobics class requires you to sign a liability waiver and say, per my doctor's consent, I am able to exercise. There's no risk factors to me exercising. And I basically give over any liability. I have evaluated myself that I am fit to be able to exercise, and I take on the liability to decide if I can exercise or not. So in that environment, they've already seen their doctor. Their doctor's already checked off on that process. They've decided and they've taken the responsibility to come to an exercise class. It wouldn't be appropriate for me to do a physical exam on every person that walked in, nor would it would be an invasion of their privacy. Like, we don't have a patient-physician relationship. It wouldn't be appropriate for me to do that. So just because I'm a doctor teaching an aerobics class doesn't make the aerobics class a medical procedure. It might treat heart disease. It might treat diabetes. It might treat a whole bunch of things, even more so than a brand, because brands don't treat diabetes, brands don't treat heart disease, brands don't treat a gosh darn thing that I can think of. But even if it does help improve those conditions, just because I'm a doctor teaching an aerobics class doesn't make that aerobics class a medical procedure. And it certainly doesn't make it that if somebody drops dead in the class that I should lose my medical license. I mean, certainly we should all take care of the person. Certainly, we should get, I should potentially do CPR, or I could do a whole bunch of things to help the person. But we have to be able to make distinctions between the hats we wear, the roles we play, the environments that we do these things in. And if we can't, if just because I got a medical degree and I'm a doctor, now in every circumstance I'm in, I have to uphold medical standards, that means when I throw a dinner party, I better take a medical history, because if somebody has a food allergy and they drop dead and they didn't tell me they had a food allergy, I can lose my medical license for making dinner for my friends. I mean, besides the fact that I'd be heartbroken that one of my friends got hurt. But you guys get my point. So, rant done. Okay, let's see. What else we got? If you weren't a doctor, this wouldn't be happening, right? We already heard about the cats. I got that. I think because you're a doctor, it's being made a big deal. Really sorry for the typos, but I'm going to have a backseat now. Well, Jean, I do appreciate it. You've been keeping the conversation going. What else do you guys think? Please tell me. There's got to be other thoughts about this. What do you think? Because I'm a doctor, am I held to a higher standard than a layperson? Does it make branding the practice of medicine because I'm a doctor doing it? What do you guys think? What other questions? What other thoughts? Anything else? I mean, it's kind of an open and shut case, right? I mean, there's not much else to say. Maybe it's just that obvious. I mean, I'm trying to figure out if I'm wrong in some ways. Like, I'm trying to figure out, shit, did I really do something wrong? I mean, I've been racking my brain about that for quite a long time, but I think the whole thing is a travesty. I do too. I don't know the difference between the word travesty and tragedy, but maybe you can enlighten me, Ori. I agree. I'm heartbroken. I don't know what else to do. I'm recording these videos partially because I think it's extremely important that we make these distinctions and we think about it. So everything will be on the record, and these distinctions will have been discussed. And obviously I will continue pursuing the appeal and, submitting our brief for the Article 78 and submitting all of these arguments to, a bigger court so that they can examine the jurisdiction that the OPMC took, the liberties that they took in this case. I think it's quite a far reach to say that branding was a medical practice. I agree, Vicky. I'm sorry, I can't think of anything else. Carrie, you're so sweet. It seems obvious. I know. And sometimes I'm like, but maybe I'm biased. I mean, clearly my perspective is biased, but I don't know. It's tough. When the media destroys, when the media creates a narrative where people believe that you were part of some sort of sex cult, and that women were being victimized and groomed for some mastermind, which is ridiculous in itself. But it preys on the fears of the public, and it gets people all crazy, just like COVID did, and they can't think straight. They can't make distinctions. They can't question or critically think. It becomes very difficult, and then the medical board is on the hook, so to speak, of the public and in the public eye. And if they allow me to keep my medical license, Are they condoning me to participate in activities they don't understand, in organizations they don't understand? And what does it look like if they allow me to keep my medical license? It's a tough position for them to be in, but it doesn't mean that they have the right to be able to overstep their jurisdiction and play morality police. It's not up to them what I do in my private life. It's not up to them to judge whether what I did in my private life was moral or not. It's up to them to figure out if I committed some sort of medical malpractice within my medical practice to my patients, and if I'm unfit to be a doctor. Now, if branding was the practice of medicine, then the way that it was performed did not uphold medical standards. And that's for sure, because it wasn't a medical process. So we didn't have to use anesthesia. That wasn't the point. There was no history and physical that needed to be done, because you don't need a history and physical to do a brand. So the first part that they had to get me on, quote unquote, the first part that they had to justify in their minds was to say that branding is the practice of medicine. And if branding is the practice of medicine, then Dr. Roberts certainly didn't uphold the medical standard, and we should take her medical license. However, they justified that first decision. The first decision, the premise upon which this case is predicated, is absolutely false. And I think that these conversations really elucidate that. And if somebody points, I've been going through this for 4 years. I've heard all of the prosecution's arguments. I've heard their expert witnesses. They've had plastic surgeons, they've had infectious disease doctors, they've had witnesses come on the stand, including Sarah Edmondson and some of the other people that she has spoken to and inspired. I've heard all of their testimony. I've questioned, shoot, am I wrong? Is this really a medical process? Did I do something wrong? Am I a bad doctor? Did I not take care of people? Did I not consider these women? Was I negligent in some way? That would break my heart. The last thing I want to do is hurt someone. That's not ever something I signed up for. We had an agreement. These women wanted this. And I'm a good fucking doctor. And I know I'm a good doctor at this point, after 4 years of racking my brain and questioning it and going through it. I know I'm a good doctor. And it's very sad that my skills are not being able to be utilized to help people. And I'm still utilizing my skills to help people, of course. My classes and all of that are helping people tremendously. I hope these conversations are helping people. I hope the stand I'm taking against this preposterous invasion against our freedoms and our rights is helping people. So clearly I can still help people, but you guys understand what I'm saying. With all the training that I've had, there are more sophisticated medical processes I could be helping people with as well. So all of that to say, I have something to say and I will just DM you. I appreciate that, Jean. I will read it. Hey, Mason Templar. I don't know your first name. Can you drop it so I can address you properly? Seems like everything now is to make an example of someone to support a narrative. Yeah, and that's exactly what we're standing against. That's exactly why we're making the coalition. That's exactly why I'm speaking out. That's exactly why we're doing what we're doing. Because honestly, if we don't, when situations like this arise, they'll just take more and more of our liberties and encroach more and more and more into our private lives and control more and more of our decisions. And I just can't have that. Because I like my life. I like my ability to make my own decisions, to create my own social life, my own relationships, my own whatever my fabulous creative little mind wants to create. So, what happened to personal agency? Yes, Vicky, what happened to personal agency? What happened to it? Where is the responsibility in this gosh darn country? This would never have happened if a few select women didn't need to be saved of the consequences of their own decisions. Who are you, and can you come over for dinner? I mean, yeah. Just makes me angry. I understand anger. I understand rage at this point. I understand all of that at this point. And it makes me angry too. But I have found much more acceptance over this period of time. And it's just, the anger needs to be channeled into a productive method of helping other people and helping this not continue to happen. So I know it's very interesting. When all of this first started happening, just a little tidbit, this was, the women claimed that they were saving us. We were in DAS and we were part of this group and we were happy. I signed up, I was getting the coaching I wanted. I was very happy. And there were people that weren't in DAS. There were people never in DAS, and I can reveal their names because they've already publicly revealed their own names, but Bonnie Peace, Mark Vicente, these people created HBO documentaries. They were never in DAS. They never experienced it. They had no idea if it was good or bad, but they were going to save me from it. They were going to save me from my own decisions. Which I'm sorry is very laughable and very sad. If an exterminator stepped on a bug during his inspection, can his customer have him fired for not doing it in the way that he advertised? Because if a friend stepped on the bug, there would be no issue. I know, it's kind of like slipping and falling on somebody's stairs. If an exterminator stepped on a bug during his inspection, can his customer have him fired for not doing... Oh, he's supposed to exterminate them with chemicals, not step on them. This was murder. I don't know. I mean, it's very funny to think about. We all have these weird things. We all have these weird ways of making things work in our head. So anyway, I love you guys. This was a great conversation. If there's anything else you can think of, if there's any other reason why you think this might be the practice of medicine, or why there's some blind spot I have that I'm just not seeing. I haven't seen it in the past 4 years, but I'm still looking. And please, if there is one, message me if you don't feel comfortable talking about it here. And please, share the good news. Share the good news with all of your friends. If there were people that have been wrongfully treated, their stories have been wrongfully spoken, we are going to have platforms. I'm doing things more and more and more to help people have more of a voice, to get out there so that we can make a change, educate people. We are certainly taking steps to hold the legal system accountable. Legal steps and media steps. So if you want to get involved in any of that or all of it, please DM me, send me a message. We will find a way based on your skill set, based on what you do, based on what you love to do, that you can get involved. I want everybody to be able to actualize their own dreams, their own vision, their own what they feel passionate about. And there's certainly enough room for all of us to get involved in this. So if you want to get involved in some way, please contact me. Definitely still need funding for the appeal. So go ahead and go to my website and hit get involved. That will take you to the Give, Send, Go page. Go ahead and donate. Even if it's a little bit, it inspires other people. You guys might think like $100 will do nothing or $50 will do nothing. Honestly, for morale, for inspiring other people, for keeping the ball rolling, like in so many ways, it is so helpful. And for yourself, like, okay, this is what I could give. And I contributed to this thing. I contributed to making a change in the world. I contributed to something I believe in. And, I think that feels good for all of us. So please, in any amount that you may want to contribute, or if there's other ways you want to contribute, please contact me. And if you also would prefer to get some kick-ass training and teach yourself how to become a total badass and be able to stand up to whomever or whatever you see in the world that's not right, You want to be able to train your mind, train your emotions, and train your body to be able to build more of what you want in your life. Please DM me. I have another course starting on the 20th. Registration closes the 11th. That's this Friday. If you're on the fence, if you don't know, if you just want some details, if you're not sure if it's a good fit, I do a 15-minute interview with anybody who's interested. And basically that just helps me figure out, is this a good fit for both of us? Is this something that's going to help you achieve your goals? And if it is, I will let you know. If it's not, I will also let you know. And we can figure out, we can get clearer on your goals. We can figure out the best ways to help you. Certainly if you decide not to, there's no hurt feelings. Sometimes that conversation inspires you to take the next step in your life and go do great things, even if it's not taking my course. So, if you do decide to take the course, you will get some kick-ass training. You will be amazing, and you'll make a tremendous amount of change in yourself, and I'm sure for other people. And you will also contribute. Your tuition will very much go towards me being able to follow through with this appeal and make sure that happens. So all around supporting good things in the world. And that's pretty much all I got for you guys today. If there's anything else, please let me know. I 100% still honor and acknowledge my little buddy RJ, and will continue to do so on all of these talks, because God, if it wasn't for that little dog, I don't know what I would have done for the first 4 years of this fight. So I might be finishing it without him, but he's 100% in my heart and has gotten me, has helped get me to this point. Sweet little warrior in himself. All right. I love you guys. Stay tuned. Tuesdays and Thursdays, 6:00. Bring people, share this video, get the message out. If you have people you can connect me with that are big wigs, Russell Brand, big talkers, anybody who speaks about stuff like this, please introduce me. Please. All right, guys. Have a fabulous night, and I will talk to you next week. I'll talk to you on Thursday.